day, everybody. Thank you for your participation to the 2021 Shine Conference. My name is Annie Duremdes. I'm a nursing practice specialist here at Johns Hopkins Bayview. And we are glad to have Heather Watson, our nurse scientist for JHHS, to talk about IRB 101. Would you like to introduce yourself, Heather?
Hi, Annie. Heather, I am the nurse scientist for the health system, and I'm excited to be here today. Thank you for having me.
Oh, I'm glad. So I know everybody is talking about IRB if you have a big project to do, but how do we actually start and what is an IRB?
Okay. Let me just talk a little bit about some of the things that I get questions about, and then I'll answer your questions. So a lot of times people ask me, like, what is the purpose of the IRB, which is what you just asked me, and kind of what the projects are that people need to involve the IRB in, and what a principal investigator is, and what are co-investigators in study teams. So those are some of the things that I would like to talk about. But to answer your question, the Institutional Review Board is a regulatory structure that's in place to protect human subjects research. And that's a fancy way of saying that when people participate in research, they can be assured that there has been work done in the background through the IRB to make sure that their data is protected, that the things that they're being asked to do are scientifically sound. And these things came into place because there was a time, sadly, in medical history where those protections weren't in place and people were taken advantage of, especially vulnerable populations. And so that's why we have an IRB. So it's a really important element for when you conduct any kind of human subjects research that you have an IRB in place.
Does most of the project require IRB approval?
Well, the types of projects that need IRB approval, all research involving human subjects. So if you're going to do anything where you're accessing people's private health information, if you are, say you want to interview some nurses about their experience during the pandemic, for example, that's still human subjects research. So those kinds of things need an IRB review because they're research and human subjects oriented. There also is an IRB process for quality improvement. Now, a lot of nurses participate in quality improvement, and quality improvement, it's not required that you get an IRB approval for it, but it's strongly suggested because it lends it some strength in publishing, and it also makes sure that you've really thought through your quality improvement project fully. So it's a good idea to have a IRB approval, but it's not absolutely necessary. But you get an approval for research, you get acknowledged for quality improvement.
Oh, thank you for that information. So how do you actually participate in an IRB approved study or project?
So participating in an IRB approved study or project requires a couple of different things. So there's a couple of different ways you can get involved. One is somebody can ask you. So somebody may say, hey, Annie, I would love it if you would be part of my study team. I would like to look at this particular workflow in peri-op services, and I think you would be great on my study team. And you would say, oh, I would love to, but first you need to complete some training because you need to understand the IRB process. So there is about 4-ish hours of training that's involved in order to participate in an IRB approved study. So that's one thing that you need to know. And then the other part is if you are going to develop your own study or your own QI project that you want IRB approval for, then you would need to become a principal investigator. And that's a little bit of a different pathway.
That's interesting enough. So, as a what is the principle for a principle for a principal investigator?
So a principal investigator is the person who bears the responsibility of the safe conduct of human subjects research. So they're just kind of the person who's in charge. They're often the person who is driving the research question, and it can be a team of people. So you can be the principal investigator and also have co-investigators, and then you can have study team members. So they're a little bit different, but the principal investigator is the one that says, whatever happens during this study, I take responsibility for it. So if something goes very, very well, they take responsibility for it. And if something goes not well, because sometimes things happen, there are risks. And for example, if somebody's information accidentally got hacked or lost, the principal investigator would report that to the IRB. That's part of their responsibility. So it's a charge that you are saying that you will lead it. You will lead whatever the project is.
Yeah. So who are the staff or nurses who can be a principal or eligible to be a principal investigator?
That's a great question, Annie. So there's a lot of different people who can be principal investigators. So a lot of faculty, obviously through the schools and institutions, are principal investigators, and anybody who has completed a certain level of education. And so there are specific eligibility requirements for nurses to be principal investigators. So again, if you're interested in being a principal investigator, there's some steps you should take. Becoming a PI as an RN means you need to have a master's of science in nursing as a minimum. And so clearly anybody who's completed their DNP or completed their PhD, they've met that minimum requirement. In our health system, you have to have had at least 1 year experience as a nurse outside of your training and orientation in order to be a principal investigator. You need a letter of endorsement from your director saying that your employment is in good standing, that they support your project, that essentially you have the backing of leadership. So that's always an important element. You need to have been a co-investigator on an IRB approved study. So this is where that co-investigator piece is really important, because if you're interested in someday doing your own project, then you should try to get on somebody else's project first. So, and we can all help each other out by inviting our nurse colleagues to participate in research that we're doing by making them co-investigators. So that's one of those steps towards becoming your own principal investigator. And like we discussed before, you need to have completed that IRB training. And then there's one extra training for principal investigators called rewards training. And it goes a little bit more in depth into some of those responsibilities of a principal investigator.
It's a good step that you do need to be a member first and be a co-investigator to become a principal investigator.
Right. So you definitely need to be a co-investigator on a study before you become a principal investigator. And it's a good idea anyway, because then you learn the steps of what is involved in project work and in study work. And a study team member is a little bit different than a co-investigator. So you can be a co-investigator if somebody invites you to be, but you can be a study team member without being a co-investigator. So I can tell you from my history, I was a study team member when I worked at the School of Public Health as a senior research nurse. I was a study team member on a couple of different studies, but I wasn't a co-investigator because I didn't write the study or come up with the idea.
Oh, that's really good information for those who are interested to be part of a team or to be a co-investigator or then hopefully become a principal investigator. So these are really comprehensive information that you just shared, Heather. So is there anything else you'd like to share about IRB 101?
Um, just that, just that the IRB really wants you to be successful. I think there are a lot of folks out there that feel intimidated by the IRB. I personally, I sit on one of our IRB boards. I sit on IRB Expedited, and the people they genuinely want people to do good project work at Hopkins. And so they're there to help. There's a great staff at the IRB that there's a help desk phone call that you can call, and they can help walk you through all of the documents that you may need or all of the requirements to become an investigator. Being part of the study team is a great learning opportunity. These are the things that drive our nursing practice. So it's really exciting to participate in them. And ensuring human protections is obviously something we all care about. It's our safety, it's our patient's safety. So these things are important. And you may, even as a nurse, encounter research that other people are doing and you're not on the study team. So it's good to have a general awareness about it. The IRB website has so much information, and it's included in this PowerPoint here. And so I would encourage everybody to go to that website and just kind of glance through it. And again, if you have a lot of questions, you can always come to us at the Center for Nursing Inquiry. We also have links on our webpage to forms, to those requirements to become a PI as an RN. And then also we're just generally available to answer questions that nurses have if they want to get engaged in inquiry work. So this is one of those first steps. And once you do it, it's easy to maintain. It's kind of like anything else. You have some training every few years just to keep you up to date on things. But once you put it under your belt, then you'll always be able to log into that IRB website and generate an application, which we can talk about the next time we meet.
Okay, great. So thank you for all this information about and taking the everybody's scared when you talk about IRB. So just we're putting clarity on how the IRB process is. Thank you. This is really great information. And thank you for those who's able to attend this conversation with Heather. All right.
Thank you so much, Annie. I appreciate you. Take care, everybody. And I hope you're having a great time at Shine.
All right. Thank you.